Hi, everybody. My name is Brady Cass. I'm with Regis Blue Shield, and it's my pleasure to be your host and moderator of the webinar today. You know, in the midst of the COVID pandemic, we're particularly excited to be talking about the topic of behavioral health. We've noticed both an increase in demand, as well as an increase in access to care of behavioral health services during the pandemic. And one of the things we're excited to share with you today is to inform you that if you're on one of our non-HSA plans, that your access to behavioral health services, online behavioral health services, has become actually a lot easier, or will become a lot easier in January 2021, in that we're offering these services for you with no upfront cost sharing on them. So we're moving these to a $0 copay, and that applies for all of our non-HSA plans. Today we'll be joined by Dr. Drew Oliveira, who is our Senior Executive Medical Director, and Faith Dickinson, who's one of our clinical program consultants, to walk us through some updates and just really their insights from a behavioral health standpoint. So at this point, let me turn it over to Dr. Drew.
Hey, thank you, Brady. It's really important as we continue to move in this next normal of the COVID-19 pandemic to really focus on how do we take care of our own health, and especially on the mental health side of things. So we've seen a number of things happen since March of this year, especially related to loneliness, the impact of COVID fatigue, if you will, the increase in anxiety, depression incidents, and how that impacts our daily life, not to mention the disruption that almost everyone has felt in terms of work life or just their every day-to-day operations. So as we've been working through how do we support our members better, one of the big focuses for us has been on the behavioral health side. And as you can see on the screen, we look at everyone across a full continuum. And this slide works really good, in the pre-pandemic side, because there are, it's clearly going to be people on the right-hand side with serious mental illness. We are going to continue to work with that population. They need increased specialized behavioral health services in general. They represent, a large section of the cost. And it's a lot of that is working with our providers, making sure people are getting care, accessing care at the right time, taking their medications, adhering to those medications that they're given, not having side effects, et cetera. So we continue to do that, every day. We've also, always thought about there's a whole nother large group of people, maybe 70% of that population, that either doing very well, or maybe they might have some concerns, but they're lower level. They don't typically talk to their provider about that. They may not even talk to a family member or a loved one about that. So we could call those people the worried well, but they also may just be well. Since COVID hit, I think there's a lot more people that are worried and or maybe not as well as they think they are. And then in the middle has been those people that have been suffering but have been somewhat silent or excluded. And that's a fairly large piece of the population, and a larger piece of the population than we've been dealing with in the past. Those are people that really probably should get access to care. There are a number of tools that Faith will talk about in a moment that we've been adding into our offerings for members. Some are going to be self-help tools, so things that you can do yourself to learn more about how you're doing, to become more mindful, and maybe even where you might have mild or moderate conditions, to actually get some do-it-yourself, if you will, help. So virtual cognitive behavioral therapy is a type of program that you can do on your own time frame to get better. The other piece to that is we're mining data on a daily basis to identify members that may be at higher risk, and reaching out directly to their primary care docs to inform them and maybe have those primary care docs do an outreach and bring those people in, or if they need to be referred to a higher level of care to actually do that. There are a number of things that we all need to do to improve ourselves. And I think as you think on the next page, it's really about helping that full spectrum strategy, if you will. So how do we reduce stigma of behavioral health issues? How do we prevent some of those things from occurring where we can? How do we build resilience within our members and our population and frankly, our community? How do we then identify people early? How do we use data to support that? How do we then use that data to effectively engage, a member or their family to get care? And then where do we actually target access where they need to see that provider? As we were talking before about those higher risk people, those people that need to be referred, let's target them appropriately and get them into care early so that we can make an appropriate intervention. And then lastly, there's still going to be that complex management. Those people with very complex mental health issues or mental health issues that are going alongside a medical issue where you need to coordinate that care between either a mental health provider and a medical provider. Could be surgery, could be even palliative care. And then also bringing in other support services as someone might need. That could be caregiver services, et cetera. So with that, I'm going to pass it over to Faith, and she's going to talk about a number of the programs that we have in our portfolio to help members to continue to make it through this pandemic so it doesn't become worse.
Thank you, Dr. Oliveira. So as was mentioned, I'd like to take some time to talk about the solutions that we have in place to help support our members through the growing need for behavioral health treatment. As was mentioned, we know that this pandemic has already brought the need for behavioral health to the forefront for many people, more so than it already was for most. And so looking at the solutions we have and the tools that we have, I just want to highlight some of the ones that we want you to know about. So care management is probably one of the more well-known programs that we have. Facility management is also known as utilization management, but our role goes far beyond establishing medical necessity for services. So our goal is to be able to be that connection for helping a person access the appropriate levels of care. So that's our job now, to help address any barriers that might be in place that are going to make it difficult for them to get to that treatment, or able to support members through that transitional period all around. It's not always an easy navigation process. And so our facility management team is there to help them through the whole way. So our clinicians follow the member through their entire episode of care so that there's one person focused on them solely. So for example, if a member were to go to inpatient mental health treatment and then step down to another level of care, such as partial hospitalization or intensive outpatient care, the same clinician continues to follow and support them throughout that whole treatment episode. And one of the really important things about this, it gives us the ability to not only get a better view of the member's condition, how they're actually responding to the care, what's working and what's not, but it also helps us to understand if there's any social determinants of health that are impacting them and their ability to be successful in treatment. And if so, how can we help them navigate those as well? We also ensure that when our members do discharge from an inpatient or an ER setting, they receive a call from our team to make sure they have appropriate follow-up appointments and supports in place. So especially given the fact that oftentimes individuals can be emotionally fragile, overwhelmed, leaving a hospital setting is very difficult. There's a lot going on. There's a lot of things being thrown at you with discharge appointments and instructions. And it's easy to get overwhelmed and to not remember things and not know where to go and not know what to do next. So our team makes a call out to make sure that the member understands where they're supposed to be going next and what is that appointment and who are they going to see, and do they have their medications available? Do they know what they're taking? Do they know what they're for? Do they have any other needs? So these calls are really helpful for the members just to make sure that they've got one more layer of support as they transition to that outpatient care. Another program we offer is our case management. So this is typically for members with a higher level of behavioral health needs, or an increase in those social determinants of health that are making them have difficulty getting to treatment or getting that care that they need, or for anyone who requests it. Anyone who feels like they need that extra layer of support, we are here for them. So this gives a person access to our licensed mental health professionals, and they assist in connecting them to additional providers, resources, other supports, even nonprofit organizations to help meet their needs. So this care is really exclusive, and it's tailored to the individual's unique needs. So when I say exclusive, I mean focused on this member. It's about this person. It's not about a textbook example. It's what this person needs in this moment. So that the member gets to work with our clinicians, and they get to put together a plan with goals and tasks that they're going to work on together to make sure that we're meeting the needs. And it's not a time limited program. So we may work with a member for a month or so, or we may work with a member for a year. It's whatever it takes for us to help get them to where they need to be. It also is at no cost to the member, and they're welcome to access the services multiple times, throughout their journey with Regents. So we're always here for them to be able to support that. My Strength is a great tool also. So this is a digital online self-serve behavioral solution that has mental health and addiction wellness models that can be accessed anywhere. So this is something that members can go to in privacy of their own home. They have access to a number of common issues with modules to help them work through, such as depression and anxiety, even some that address other current issues such as the pandemic and political unrest and racial injustice. So the modules are really great. As Dr. Oliveira mentioned, they are based on the cognitive behavioral therapy and the dialectical behavioral therapy skills. So those methodologies help individuals to navigate the difficult thoughts and feelings that could be causing disruption for them. So it's actual tools and skills that they will learn in these modules, but they can carry on in their daily activities and in their daily life. So they all are complimentary for members and their employees and their families. They also have quite a lot of COVID-related modules that are there as well. They're also free of charge. So this next slide, I want to highlight just a couple of these. So we know that there's a lot going on, and with COVID and all of the things that come with that, a lot of these topics that seem, navigatable in a regular setting are getting more difficult. So for example, parenting in challenging times. This is getting to be a concern for many of us. Okay? So parents are trying to learn how to juggle their own working from home, virtual homeschool for their children, maybe family caregiving, financial concerns, all of the things that come along with that. But on top of it, they're still also trying to figure out how do they support their children and help them understand all the things that are going on and all of their feelings and help them navigate this time. So this module, and it has many modules inside, helps to give them the tips and the tools and the tricks that they need to be successful in that. Another one is staying connected while social distancing. It's a great module as well. The importance of connectedness to our mental wellness is not always given enough consideration. And this lack of in-person socialization that we have now is taking a toll on a lot of people. And we need to learn how to maintain that connectedness even when we're not in person. So again, another great module that to teach those daily tips, tricks, skills that we can use to help manage and help adapt to what's going on right now. So overall, the modules are just great in helping to manage those feelings of uncertainty and fear that a lot of people are feeling, and a lot of us can definitely relate to. So Quartet is another great vendor that we've started working with in Washington over this past year. So the primary objective of Quartet is to be able to make behavioral health care accessible and easy. And the way that they're doing it is by embedding it in the primary care setting and providing it in a concierge type support way. So they're able to help a member be able to get connected to behavioral health providers from the comfort of their own home and really taking the work out of it for the member. So this allows the primary care provider to be able to refer someone to Quartet. So when they do, Quartet will reach out to the member, talk with them, see what's going on, assess what their needs are, what preferences they might have in terms of what provider they would like to see or what type of provider or any other factors that are going to affect their ability to be willing to get care and to have the right care. So once they meet with Quartet and they've looked at the issues and they've looked at the requests, Quartet is able to match the member with a provider type that they feel is what they're looking for and has availability, and they can get them in right away. So they usually are able to get in within 72 hours for some people to be able to get to the scheduled appointments, which is great. As we know, accessing behavioral health care, again, can be overwhelming. And the longer you have to wait, it's not uncommon for people to want to change their mind and not get the care that they need. So the sooner we can get those in, the better. And Quartet does a really great job of getting people connected to the providers in the right time frame. So they also have a couple other options that Quartet does to help support the members. So they have a curbside consultation service. So for primary care providers who are working with members with behavioral health needs in their own clinic setting, they have access to psychiatrists and other supports through Quartet for consultation, which is great. There's also a self-referral portal that was recently created. So a member doesn't have to go through a primary care provider to access Quartet. They can actually refer themselves and again, start that process on their own from the comfort of their own home, which is where many of us are these days. Okay, virtual psychiatry. So virtual healthcare services across the board have been critical during the pandemic, of course, with people not able to access clinics and hospital settings as we used to. But the same is shown true for behavioral health, and we've seen a huge uptick in the virtual behavioral health visits, almost of like 3,000% increase. It's been amazing. So as we're looking at those, we have a couple of different options that are really helpful. One of them is MD Live. So MD Live provides access to behavioral health professionals, whether that's psychiatrists, counselors, other therapists. And so this allows members to receive both medication management and therapy, both, which is fabulous from their own home. Again, the safe place to be, the accessibility that people are looking for right now. So appointments with MD Live usually take place within a few days of the request as well, assuming it's not a crisis situation, in which case the MD Live team would be able to get that member to the appropriate local crisis services or local emergency room, whatever that looks like in their area. And one of the main benefits of MD Live on the behavioral health side is that their program allows for a member to see the same therapist or the same psychiatrist throughout the extent of their treatment episode. So commonly when you do a telehealth for medicine side, for the medical side, or for a non-behavioral health issue, it's not uncommon to have different doctors or different nurse practitioners at each visit. But for behavioral health, when we're talking about getting somebody into one of the most emotionally fragile settings and helping them to be able to open up and create a therapeutic relationship with somebody, it's important to be the same somebody every time. So MD Live allows them to have the same therapist or same doctor throughout their treatment episode, which is very supportive, very important for continuity. So we've also seen some changes in our network providers and in their ability to support and handle virtual behavioral health. So before the pandemic, in-person care was definitely considered the priority and the best plan for most people. So not everyone had adjusted to the idea of using virtual services. So what we've seen now, though, is a major transition in our network providers, as they don't have a choice but to move to virtual care if they want to continue to take care of their patients, and they do. So not only their current patients to be able to continue care uninterrupted, but also to be able to take on new patients. So many in-person clinics have moved to the virtual setting. And one of the ways that we've been able to help support this is through our transition to cover these new virtual visits at parity with office visits, which helps to alleviate some of that financial burden on these clinics that are trying to navigate all of these changes and still manage to keep their patients, being seen effectively and getting the help that they need. We've even gone a step further in looking at how to use the same type of modalities for facility-based levels of care that in the past had never been an option for virtual care either. So programs such as our partial hospitalization programs and intensive outpatient programs, these usually take place in groups. So transitioning them to a virtual setting is even more of a difficult maneuver but it's happening, and it's happening very successfully. So in order to support that, we've been able to make some changes to our reimbursement and billing processes to allow this to be a smooth transition, both for the providers, but also for our members, first and foremost. So one other tool that we have that we're pretty proud of over the last year that we've been able to create in order to make sure that we're meeting the needs of our members every time is we've been able to put together a behavioral health customer service cohort. So our goal with this was that we want our members to be able to call in for help with whatever need they have, whatever behavioral health question they have, and the first voice they hear be someone who can answer their questions in a safe and compassionate way. And we wanted to do this, by giving that extra behavioral health training and education to our team so that they feel comfortable and prepared. So we took volunteers from our general customer service team, and there were a lot of people want to be in this space and want to be doing this type of work. So that was great. And we provided them additional mental health training in a couple of different areas. So one of those was mental health first aid. Mental health first aid is a skills-based training. It's a course that teaches how to identify, understand, and then respond to a person who is experiencing a mental health or substance use issue. And we chose this course so that all of our conversations could be destigmatized and safe for the members. We want them to feel comfortable calling. We want them to know that when they have that person on the phone, when the customer service picks up the phone, that we're there for them, that we understand, that we're able to meet them where they're at and help them get through this difficult situation. We also want our team to feel comfortable and to be able to know the answers to the questions and how to communicate and how to support this person in an empathetic manner. Behavioral Health 101 is another course that the cohort receives. This class gave them a more in-depth education on common mental health and addiction concerns such as depression, post-traumatic stress disorder, and substance use disorders. But also, in addition to just about the disorders themselves, we taught them about what treatment is out there for these disorders. What are the options? Where can members go, and what does that look like for them? How do you know the difference between a residential treatment program and a partial hospitalization? And what should you expect? And how do you find that? How do you access that? What's the first step? So we went through a lot of training and a lot of really good learning processes for our customer service team, and now they're able to tell you the difference between a psychiatrist and a psychiatric nurse practitioner and a therapist, and which person can do what in the community. We know that behavioral health services are not always the most readily available, and by knowing and understanding what each provider can actually do and offer, our team is able to now put together the best treatment options that we can, even if we don't at first glance think that we have all that we need. In reality, we maybe do, and we're able to put that together because they've taken the time to learn and be prepared for these phone calls.
Faith, thank you for your insight. And Dr. Drew, thank you for your insight as well. But most importantly, thank you to all of you who've joined us for the webinar today. We're proud and honored to provide the employee benefits to you through the ALLtech Health Benefits Trust. And we appreciate that opportunity. We wish you a great day and good health.